I'm going to give you a brief overview of the Medicare updates for 2020. And if you are new to Medicare or going on Medicare shortly, this video is also going to help explain the differences in Medicare, what they handle, what each part pays, and what's the best plan potentially for you to sign up for. So here we go. I like to base the information based off of the Medicare and You guide for the current year. This ensures that what we're telling you comes directly from Medicare, so that you know the information we are providing you is true and correct. So let's get started, and we're going to talk about enrollment periods briefly. So when we look at enrollment periods, there's a couple different times of the year that you can enroll. So October 1st is what we call pre-enrollment. Between October 1st and October 14th, we know what kind of prices are going to be available, what kind of plans are going to be available in any specific given area. October 15th is the first day of open enrollment where you can actually submit applications, and that door closes on December 7th for this year, December 7th of 2019. So you cannot make any elections after that date. Any plans that are selected during this time frame for open enrollment is for effective dates starting January 1st, 2020. And then January 1st through the 31st, they have what's called, it's a newer election period, which is called an OEP. And this allows folks who are on Medicare Advantage plans the opportunity to change their plan if they don't like the one that they enrolled with. Now, I want to make sure you understand when we talk about open enrollment only pertains to folks who are on Medicare Advantage plans. You're going to learn what that is here in a moment. Or folks who have a prescription drug plan, otherwise known as Part D. So if you have a Medicare supplement, there's really no such thing as open enrollment per se. Now, your Medicare options, and we're going to get more into that right now. So your Medicare options, we're going to talk about original Medicare first. So when you hear the term original Medicare, what that means is that when you become eligible for Medicare, and you go on Medicare Part A, that is your hospitalization insurance. So anytime you're admitted to a hospital, Part A is what covers that benefit. Now, if you only have original Medicare Part A and you don't have any type of Medigap or Medicare Advantage plan, then you are going to pay a deductible per occurrence. So right now, it's about $1,300. We haven't been released with 2020 prices yet, but it's going to be over $1,300 if you're admitted, even if you're only in the hospital for 1 day, and that's per occurrence. Okay, so if you go in the hospital 3 times that year, you're going to be out over $3,600 for that year. Your Part B is your medical insurance or all of your outpatient insurance benefits. So there currently is an annual deductible of $184 that you must meet out of pocket first before Part B kicks in. Once Part B kicks into place, then you pay 20%. There is no cap or out-of-pocket maximum. You will just continue to pay your 20%. If you want drug coverage, then you can join a separate Part D plan. Now, this is very important to understand. If you do not have credible coverage at all and you turn 65, you need to enroll in Medicare Part D, which is prescription drug plan. A lot of folks get caught into this where they say, well, I'm not taking any drugs, and why pay for a plan when I don't need it? The problem is, if you don't take your Part D drug plan when you're supposed to, and you decide later on down the road when now all of a sudden you have drugs that you have to take and you want to join the program, you're going to have to pay a penalty for the rest of your life. It's based on 1% each month of the average cost plan across the country for each month that you should have had the plan. So if you don't take any drugs, just go with the least expensive drug plan for that year so that you don't have to worry about penalties. Okay. With original Medicare, you can use any doctor or go to any hospital that takes Medicare anywhere in the U.S., so you don't have to worry about any type of networks. Now, under original Medicare, if you want to stay with original Medicare Part A, Part B, and you have your drug plan, the type of gap coverage that you would want to get is Medicare Supplement. Now, the Medicare Supplement plans range anywhere from Plan A to N, and they're making some changes for 2020, and Plan F and C are no longer available. Plan G is going to be a guaranteed issue, so we'll cover that shortly in a moment. But this is original Medicare. Original Medicare means you have A, you have B, which you have to pay for, of course. You have your prescription drug plan, and you have your Medicare Supplement plan. Or you can go without a Medicare sub plan. But if you do that, you're going to be on the hook for deductibles and co-insurances with no maximum out-of-pocket for the year. Now, what I want to discuss are what are called Medicare Advantage plans, known as Part C or Medicare Health plans. Now, the difference when you go from original Medicare to Medicare Advantage is you are leaving original Medicare, so you no longer have A, B, and all of this. Medicare Health plans, Part C, you're going with a private insurance company. So when you join that private insurance company's plan, they are assuming the benefits of A and B, and most of the time even including the prescription drug coverage in that plan. So if you go with company XYZ, don't worry, they still have to provide at least the same coverage as A and B. Okay, at least. And again, most of the plans do include Part D, which is the prescription drug coverage. So now you could essentially get an all-in-one plan where you're using one card from that particular provider. However, most of the times you do, to get the best cost savings, you're going to want to stay within that insurance provider's network. Okay. Plans may have lower out-of-pocket costs than original Medicare, which is true, of course, unless you have a Medicare supplement plan. In most cases, you'll need to use doctors who are in the plan's network, as we discussed, and most plans offer extra benefits. Now, this is why a lot of folks end up going with the Medicare Advantage plans, is because they are lower cost. In some cases, you can get a Medicare Advantage plan for zero cost, and it includes your A, your B, it includes your Part D. And unlike original Medicare, all right, original Medicare does not cover maintenance of dental and vision, hearing, things of that nature. They do if you have a medical issue, but as far as prevention, it does not cover those services. With a Medicare Advantage plan, each of these carriers are competing for your business, so they are looking to offer those services, vision, hearing, dental, and one of the most popular ones, of course, is having your fitness plan paid for you by the provider as well. So just as a recap, Medicare Advantage includes Medicare Part A, Part B, in most cases covers Part D, includes the extra benefits. However, there is a cost that's associated with the Medicare Advantage plans. Unlike original Medicare with a Medicare supplement plan, if you have, for example, what's called a Plan G, okay? With a Plan G, all you're going to pay is your Part B deductible for the year, which is the $184, and then essentially there's no out-of-pocket going forward for the remainder of the year, provided that it is a Medicare-approved and paid procedure and benefit. And of course, that has to all be within Medicare's allowances. With the Medicare Advantage plan, in most cases you are going to have co-pays. You're going to pay per day in the hospital up to X amount. You're going to pay X amount of dollars for labs, testing, so on and so forth. So it's kind of like having a major medical plan where you may not necessarily have a deductible, but you're going to have cost sharing. So here you can have a little bit more controlled cost. Over here, traditionally, you're going to have more out-of-pockets, but you're still going to have what's called an out-of-pocket maximum for the year. So you know you're not going to spend any more. So lower cost could offset, but out-of-pocket, if you have a bad year, could be up there. So original Medicare versus Medicare Advantage. So with original Medicare, you can go to any doctor or hospital that takes Medicare anywhere in the U.S. Medicare Advantage, you're most likely going to want to stay in the network. If you have an HMO plan, you have to stay in the network or it's not going to cover you. If you have a PPO plan, you will get the best cost savings, the lowest cost out of pocket if you stay in the network, but you can go out of the network for a higher cost if you want to see certain providers that don't take your plan. When it comes to cost, as far as original Medicare Part B covered services, you usually pay 20% of the Medicare approved amount after you meet your deductible. On Medicare Advantage, out-of-pocket costs vary. Plans may have lower out-of-pocket costs for certain services. You pay premium monthly for Part B under original Medicare. You do pay your annual Part B premium as well, which currently is $135 a month. Now, there are some plans out there in certain areas, that Medicare Advantage plans, that will though actually pay a portion or all of your Part B premium for you. Under original Medicare, there's no yearly limit on what you pay out of pocket unless you have a Medicare supplement. With Medicare Advantage, plans have a yearly limit, or what we call an out-of-pocket maximum. So you know in the worst case scenario what you could potentially be facing out of your pocket for the year. You can get supplemental coverage like Medigap on the original Medicare side to cover the majority of your out-of-pocket cost. And under Medicare Advantage, you can't buy or use separate supplemental coverage. At least you couldn't in the past, and we're going to cover that in a moment. Original Medicare covers most medically necessary services and supplies in hospitals, doctor's office, and other. The Medicare Advantage plans must cover all of the medically necessary services that original Medicare covers. However, most plans may offer extra benefits that original Medicare does not cover, like vision, hearing, dental, and more. Plans can now cover more of these benefits than they have in the past. Original Medicare, you can join a separate Medicare prescription Part D plan for your prescription drugs. Under Medicare Advantage, prescription drug coverage is included in most plans, so that's taken care of. In most cases, you don't have to get a service or supply approved ahead of time for it to be covered. In Medicare Advantage, in some cases, you do have to get a service or supply approved ahead of time for it to be covered by the plan. But in a lot of cases now, today, the plans are getting more and more away from that, especially if you're staying within the network. For traditional for travel, original Medicare generally does not cover care outside of the U.S. You may be able to buy a Medigap policy that does have some limited coverage outside of the U.S. Under original Medicare, it generally does not cover outside the U.S. You may be able to buy a Medigap policy that covers care outside. Under Medicare Advantage, plans generally don't cover care outside the U.S. Also, plans usually do not cover non-emergency care if you get coverage outside of the plan's network. Let's talk now about the Medicare 2020 specific updates and changes and how it affects you. You may have heard about or seen the Medicare MACRA for 2020. And basically what that means is that Medicare supplement plans with Part B deductible coverage, such as Plan C, Plan F, and High Deductible F, cannot be purchased by any newly eligible Medicare recipients starting January 1st of 2020. So that means those plans can no longer be bought. The following guaranteed issue plans will become accessible for newly eligible Medicare recipients. So starting in January 1st of 2020, plans D, G, and high deductible G, which is new, will be considered the guaranteed issue plans. What is the meaning of newly eligible Medicare recipients? People who are 65 years of age or become first eligible for Medicare because of age, disability, or end-stage renal sickness on or after January 1st, 2020. So if you have a Plan F now or C or high deductible F, you can keep it, but you cannot buy a new one starting January 1st of 2020. Donut hole. Let's talk about that. Everybody's heard about the dreaded donut hole. Well, over the last 10 years, well, actually since 2011, the gap coverage has been decreasing every year to make drugs more affordable for seniors. So they talk about the coverage gap closing in 2020, and I mean, but there's still some out-of-pocket cost for that. So, a lot of folks may have been under the impression that the donut hole was going to go completely away. But here's really how it works. With brand name prescription drug savings in the coverage gap, for example, this is the chart over the last 3 years. So in 2018, the manufacturer discount has always been consistent at 50%, and it will be in 2020. But the plan paid 15% in 2018, 20% in 2019, and 25% in 2020. Your cost basically went from 35 to 30 and 25%. So now for 2020, once you reach what's called the donut hole, right, you're not going to pay any more than 25%, and in some cases, depending upon the plan, not even that. All right, so the maximum that a person can pay while in the donut hole for brand name drugs is only 25%. Okay, so that is really good and affordable, especially considering the fact that the manufacturer is discounting it at 50% right out of the gate. For generic drug savings in the coverage gap, see a similar chart. So the plan went from 56, 63 to 75% this coming year. And once again, you're going to pay no more than 25% while you are in the donut hole gap. Okay. All right. So for 2020, this is what I call the Medicare Advantage game changers. Since things have changed with Medicare Advantage, we have to get what's called an SOA, or scope of appointment, prior to speaking with Medicare recipients when it comes to Medicare Advantage plans or prescription drug plans. And in the past, Medicare did not allow us to talk about any plans outside of the Medicare Advantage. Well, they changed that ruling, and they said that we can talk about health plans during that meeting as long as it gets checked off on the scope of appointment form, then we're allowed to talk about it. So this plan has been around for some time, and I've worked with a lot of clients on it, but we have not really been able to push this plan to help folks because we couldn't bring it up during that meeting with them in regards to the Medicare Advantage. What is it? It's called the Advantage Plus Hospital Indemnity Insurance Policy. Long story short, what we can do, since there are out-of-pocket expenses with Medicare Advantage plans, such as daily hospital confinement up to 5 days, ambulance that $250 ambulance fee, for example, maybe a $250 for your ambulatory or outpatient surgery fee. Those types of expenses, we can now close those gaps with this benefit. So we can provide daily hospital and indemnity benefit. We can cover ambulance trips, cancer, dental vision, short duration hospital stays, outpatient surgery, and even the skilled nursing facility. So after 20 days of traditional Medicare, then you're required to pay X amount of dollars toward that skilled nursing. This plan helps to seal the gap. So what this means for folks now who maybe didn't go on a Medicare Advantage plan before in the past because of the out-of-pocket cost, we can cover the majority of these costs now, and in some cases even get you more money per day than what your plan requires you to pay, meaning you can actually net out at the end of a hospital confinement, for example. Now we can make these plans available to you, help close off these out-of-pocket expenses with the Medicare Advantage plans. And in a lot of cases, if you have a zero-cost Advantage plan, and this plan is, well under $100 per month, for example, then we can still give you a much more affordable plan in a lot of cases than a Medicare supplement. That could cost you $130 a month with your Medicare supplement and your prescription drug plan. So really, it's going to depend on your needs, your specific area, the plans that are available, as to which plans are going to benefit you the most. Okay. So, which plan is right for you? That is for you to decide once you are armed with the proper information. You need to define the best course of action based on your needs, budget, and usage. And we're here to help you do that. We're here to help you to look at your plans with you, go over it, put your drugs into the system to see which plans are going to give you the best, lowest out-of-pocket costs for 2020, and which health plans overall is going to be in your best benefit and keep your costs the lowest as it can possibly be. Now, we are a broker, which means that we work with 99.9% of the providers that are out there in your area. This allows us to talk to you collectively, no matter what plan it is. So, we're not representing one specific company, so we can truly look at all the plans for you, and we can look up the networks of doctors and any particular pharmacies that you want to go to and make sure that the plan is custom designed for you based on your needs. So we are here to help you. American Insurance Brokers, you can reach out to us here in person if you're close to the Plymouth area, 316 North Center Street, right behind First Source Bank. If you're not close to our area, we are licensed in about 18 states, and we can do a lot of this over the phone and through the web. So reach out to us at 574-936-4152, or you could also go to our website at www.aibins.net. Thank you. Have a wonderful day.